Hey, how's it going, guys? We're Dental Force, and we've been tracking your teeth since day one. I'm Colin.
I'm Katie.
I'm Trayton.
I'm TY.
All right, so this is the influencer. Her name's Megan. She is a dental hygienist at the Central Valley Dental Care. And her problem is with seeing each patient, she has to track the depths of their teeth and then either memorize that or ask for an assistant's help to input the data into their software. So they currently use Dentrix, and they're tracking, it's a perio charting tool that allows them to record all of their patients, the depths of each of their teeth for each time they come in to visit. So this is going to be the buyer. This is Dr. Bigler. He is the dentist at the Central Valley Dental Care. And then this is the Dentrix, the software that they're currently using where they input the depths of the teeth.
So our solution is pretty simple. We are going to implement voice technology using Amazon Echo Dot. And with this, we will have compatible software so that whenever Megan talks into it, it'll be a voice-to-text type of input-output, so that way she doesn't need the middleman of the assistant. And so we're going to, in terms of the market opportunity, start at the Central Valley Dental Care, and then after that expand out into Mesa dental practices, which there are currently 100 in Mesa. And then we're going to go to Arizona, which is 3,000, and then the United States, which is 200,000. But we don't need to stop there. Once we're done with dentists, we can expand even further into other medical practices such as optometry, your regular doctor, rheumatologists, dermatologists, and all the sorts.
All right, so this is our competitive analysis. We have the buyer and the influencer, who the influencer is currently using her assistant, which doesn't offer modern interface and doesn't offer the voice technology, and it's not time efficient. However, it is accurate with recording the data. The software that they would use, or the software that they are using, is Dentrix, and they offer a program called Voice Pro, which allows them to buy headsets that can do this data, can record the data for them. However, it isn't very accurate according to the other dentists that Megan has talked to that have used this software, which is why this dentist office actually has never used it, which is where we come in, and we're going to be offering the modern interface, which is that there is no headset. We're going to be using the Echo Dot, and then it will be accurate in translating everything. It'll be time efficient, and it'll offer the voice technology.
So let me walk you through a typical sale. So Megan, who's an influencer, would hear about our product through advertisements or other colleagues. Then she would then tell John about our product. From there, John would go to our website. And at our website, it costs $150 to download the software and $50 for each additional Echo Dot. After downloading, the Echo Dots would be sent directly to their office. And once everything's set up, it'd just be a monthly payment of $50.
Okay, for timeline, we did 20 interviews on September and 10 interview and market research on October. We receive our Echo Dot and develop software on November. In the future, we will receive 1,000 of funding for test and create our MVP on December, and we will advertising and selling to other dental practice on January. We are looking for 1,000 total of funding, 100 for Echo Dot, 200 for software design, 700 for AD.
And we're Dental Force. We've been tracking your teeth since day one.